portion of the special instrument set and did both proximal as well as distal locking while freehand technique. And number 3, we have added a color-coded tibial nail extractor or more improved version of color-coded tibial nail extractor for RCT nail introducer compositioner to introduce the nail inside the intermediary canal in proper position. So the 3 changes makes this innovative technique as a very, very cost-effective way of doing suprapatellar nailing of tibia. So friends, this is not a Jogaru technique. This has very strong mathematical or scientific basis. After jumping so many steps of mathematical equation, we had come to know that the success of interlocking nailing is equal to A into C into P into Z. Whereas A is the expertise in the art of the freehand technique of locking, whereas the C, P and Z are the respectively the availability of the C arm in your OT and protective sleeve in your special instrument set and G in your special instrument set. If you increase the value of K to such an extent that the Z becomes 0, that is dependence on the G becomes 0, this creates a scenario where the surgeon has mastered the freehand technique of locking and can perform both proximal as well as distal locking without the G. So this is the mathematical basis. So we conducted a study between March 20 to March 22-5 on 100 cases of non-articular fracture of the tibia done by Dr. Thakur innovative technique of suprapatellar nailing of tibia. So along with the other instruments, we had 2 pilot instruments. Number 1, a color-coded tibial nail extractor, which is present in infrapatellar nailing set, and a more improved version of the color-coded tibial nail extractor called RCT nail introducer compositioner to introduce the nail. This is the skin incision. You can see the transverse incision has been given, but you can give vertical incision also. This is the innovative part of this second picture shows the innovative part of this innovative technique, the introduction of the trocar and protective sleeve from PFN A2 set inside the retropatellar space. And the third picture shows the innovative part of this innovative technique, that is the proximal locking by freehand technique. So after making a hole just medial to the lateral tibial spine, we introduce a malleable guide wire. After percutaneous reduction of the fracture with the percutaneous forceps, and after serial leadingly, we mounted a appropriate side nail over the color-coded tibial nail extractor or RCT nail introducer compositioner, and finally we introduced the proximal as well as distal locking by freehand technique. So this is the flow diagram, nothing to repeat it again, and this is the pre-operative, post-operative follow-up steps. Again, you all are aware of this. This is same as the infrapatellar nailing of tibia. No patient complain of knee pain in our series. All patients get full range of movement in our series by 16 weeks. At final follow-up, 4 cases found excellent results, whereas 30 had good results, whereas 2 had subacute infection at the screw site and 1 had infected non-union. The average time of union was 80 plus minus 10 minutes, whereas average fluoroscopic time was 38.5 plus minus 6.5 seconds. All patients followed 2, 3, 6, 8 and 12 weeks, and the average time of the union was 8 weeks post-surgery, whereas complete union occurred by 12 weeks in all our cases. These are the few cases, clinical as well as radiological pictures of the few cases done by Dr. Thakur innovative technique of suprapatellar nailing of tibia. So the number of studies done on this innovative technique is small. I think this is the only study done by me, although good number of patients were included. The study was not comparative with the standard technique, so a status of heart disease over the pipeline metroclea was not evaluated in this study. There was furthermore studies required to compare this innovative technique. We had a high-tech presentation in IOACON and found a space in International Journal of Orthopedic Sciences. You can see, and this is a video we don't have time to show you. So the take-home message is this technique would prove a boon for small and medium-class hospitals situated in BSC Great Town in India and poor countries like Bhutan, Nepal and Bangladesh, where the allocation towards the health is very, very low. So this could prove also a very useful technique for Ayushman Bharat Yojana, which is the dream project of our Prime Minister, Shri Narendra Modi. Thank you very much for patient hearing.
Choose from thousands thousands of realistic voices to use in your content. Change the way you record podcasts, voiceovers, and branded content with the #1 AI-powered voice generating technology. Stop searching for the perfect voice and stop wasting time re-recording take after take. Try 11 Labs for free and start elevating your content today.
The traditional teaching that the 99.99% of these cases unites without any significant deformity and without any significant functional impairment. But later on, it was found that there are severely displaced fractures, severely comminuted fractures. About 15% of cases require surgical treatment either in the form of tense nailing or the internal open reduction and internal fixation with plating. So let us come to our main topic, that is tense nailing is unlike conservative management. It provides stable fixation and early mobilization and reduces the risk of non-union and malunion. Tense is less invasive, resulting in a smaller incision, reduced soft tissue damage and fewer potential complications, making it an attractive option for managing displaced fracture of the clavicle. So we conducted a study between March 2022 to March 2025 on 25 cases of clavicle fracture, mid-third fracture, or were simple displaced fracture according to AO classification 15D1 and 15D2. The age of the patient was 16 to 48 years. No comorbidity was found in our study group. So all patients treated by titanium elastic nailing in my hospital. So the mode of trauma, road traffic accident was the main mode of the trauma, whereas fall from height and fall on out the state side was the other mode of the trauma. So these are the typical mode of injury, the fall on the shoulder to protect the head injury in the road traffic accident. This picture is taken from AI. And this is a typical clinical presentation, a bump at the site of the fracture, and the skin appears as if the fragment will penetrate the skin. And this is the radiological typical presentation, more than 2.5 centimeter displacement, and the jet type of condition are the radiological indication for the surgical treatment, either in the form of tense or internal fixation with the blade and the screw. So these are the already explained. The simple fracture were taken into consideration. Displaced simple fractures either spiral or oblique or transverse or short oblique, 15D1 and D2. The patient tries to find if you are affected, lip elevated, and the arm are hanging outside the table, so that we can facilitate the abduction and external rotation at the shoulder to facilitate the reduction of the fracture by closed wing. The incision, small incision, and a transverse or longitudinal incision about 1 to 1.5 centimeters, just lighter to the sternoclavicular joint is given, and after making an incision, we make a hole with the help of drill bit, and then we make this hole continuous with the intramedullary canal of the clavicle. But this is very, very crucial still. One should take his own time and use tips and tricks to do this step, because the heart and lung, like vital structures, are waiting for an instrument to escape. So after making the hole, we did tense nailing after close reduction or mini incision reduction. So the immediate post of pain management and immobilization, at the 2 weeks we did suture removal, at 6 weeks radiographic assessment of the fracture area, and 12 weeks the functional assessment, and if required, the implant removal was done. And the operative time was 30 to 60 minutes, whereas fluoroscopic time was 10 to 30 seconds, and the blood loss was 20 to 50 ml in all our cases. So the excellent result in 76% of cases, whereas 16% cases were good results, and fair and poor results were 4% each in our study group. The complications are nail bypass, superficial infection, and the malunion, each were 4%, whereas hardware irritation was 8% in our study group. And these are the few cases. You can see that 15B1 fracture treated by titanium elastic nailing, beautiful surgery without use of any instrument, reduction by shoulder movement, external rotation and abduction, and with the help of the thumb and index finger, the beautiful surgery. And this is another case, yet another case of the 15B1 fracture treated by titanium elastic nailing, yet another case of 15B1 fracture treated by titanium elastic nailing. These are the 15B2 fracture, this is 15B3 fracture treated by titanium elastic nailing. Ideally, it should be treated by open reduction and internal fixation, but we did tense nailing, and you can see that 6-month follow-up, the beautiful radiological union. This is the functional result. You can see so the time is less. So the limitation of this surgery is a small number of cases included in this case, in this study. So the short follow-up period and retrospective design. So a study with large number of population and long duration of follow-up and prospective study is required to establish this modality of treatment as an attractive option for the treatment of displaced fracture of the take-home message is tense nailing is effective for the clinical fracture with good to excellent outcomes, minimum complication if the patient are selected properly and the technique is performed properly. The further study are needed to confirm the long-term efficacy of this. This work published in International Journal of Orthopedic Science.
दोनों की शादी में सेम फोटोग्राफर था, सेम एल्बम बनाई, पर आज उसकी एल्बम में गोवा की फोटोज है और मेरी एल्बम में सिर्फ शादी की पुरानी फोटोज। क्यों? सिर्फ हस्बैंड की सैलरी का फर्क। मेरा नाम पूजा है, सूरत से। मेरी और मेरी बेस्ट फ्रेंड मीरा की शादी सेम ईयर में हुई, 2022 में। मीरा की शादी एक डॉक्टर से हुई, सैलरी 5 लाख रुपए। मेरी शादी एक प्राइवेट कंपनी वाले से, सैलरी 22,000 रुपए। पहले 6 महीने एडजस्ट कर रही थी, पर धीरे धीरे डिफरेंस समझ आने लगा। मीरा कहती 5,000 का सूट लिया, 5 स्टार में गए। मैं सब्जी खरीदने के लिए भी हस्बैंड से पूछना पड़ता, सब्जी लेनी है 30 रुपए दे दो। उसके घर गई, 50 इंच का टीवी, एसी, मॉड्यूलर किचन। मेरे घर पे पंखा भी नहीं चलता।
17 years old man, the road traffic accident was the mechanism of injury. Clinical presentation, severe pain and deformity, and inability to bear the weight on the right side, whereas the left side he had a gallaging fracture. So the challenge was the patient presented with significant surgical burden and the major long bone fracture concurrent with the complex forearm fracture and dislocation, which we call the gallaging fracture and dislocation. And this is the X-ray of the femur, the sharp femur, the mid-third fracture of a 17-year-old gentleman, and the forearm gallaging fracture, severely displaced fracture. Inner canal, it was narrow, so the nailing was difficult. The standard treatment is nailing, and ideal treatment for this gallaging fracture is the plating. But I opted nailing, although it was difficult nailing in the both fracture. And the slight distraction, the tense nailing for gallaging fracture, and this is not reported in any literature for such a severely displaced fracture. The tense nailing should be considered. In fact, there is no literature present for the tense nailing for this type of gallaging fracture. So we did for the minimally, because it is minimally invasive, and periosteal and endosteal blood supply are maintained in both fracture, and the interlocking nailing was done in the sharp femur, and only 9 millimeter nail could be negotiated because the narrow medullary canal. So there is slight distraction, as you can see in this picture. But we did locking, it was difficult nailing. So the goal was to provide sufficient stability for early mobilization despite of an anatomical constraint, and implant was 9 millimeter nail and technique was minimally invasive, and whereas in this left radius, the Galeazzi fracture, we did 10 snelling. In this case also, the 2 millimeter 10 snell was used. Usually you use the 2.5 millimeter 10 snell, but we use 2 millimeter 10 snell. Still there is distraction at the fracture site. So this was the problem with this due to the narrow canal. With this due to the narrow canal, but this is the 6-month follow-up. You can see I sent this X-ray in Indian Orthopedic Research Group, IORG, and they told to revise this case, bone grafting and plating for Galeazzi fracture. So, but I left it and wait for it. This is the 8-month follow-up. Still there was better union than 6 months, but this was not hypertrophic, and this is 11 months. You can see. So after waiting 11 months, the union is complete in both the fracture. The secondary colors have been formed. It was not hypertrophic non-union. It was the union, secondary union was taking place, although it was delayed union, but This is the functional result. You can see that supination, pronation, and wrist movement, flexion and extension all are present. And the tense swelling provides sufficient stability for secondary union even in length critical fractures because the narrow canal and the length should be maintained and DR, UJ should be reduced properly. We followed throughout 11 months for this maintenance of the length and DR maintenance. And advantages of this minimally invasive approach for Gallagher fracture and femur is minimally invasive and reduce operative time and significantly minimize minimum blood loss. And this is the conclusion that the TENS is viable, effective alternative for plating for the complex forearm injury. The successful management of this double fractures case confirmed that interlocking nailing of femur and TENS yields higher union rates and excellent functional outcomes. This approach should be considered for Gallagher fracture in adult after further studies, because I think this is the first case in severe Gallagher fracture. I did TENS. So this case was published in International Journal of Orthopedic Sciences.
पैसे उड़ा मत दियो, सही म्यूचुअल फंड में इन्वेस्ट करियो।
मेरी टीम है ना। हमारे पहलवानों, टारगेट पे फोकस, लार्ज के फंड पे लगा दे। मिड कैप फंड का क्या करूं? डाल दे। भाई आज मार्केट वोलेटाइल सा लग रहा है। कीवर्ड भी नाकाम करे है। ये टीम नहीं, मेरी फोन पे की टीम, पहली टीम जो स्पेशल क्रिस्प स्कोर कार्ड यूज करके हजारों म्यूचुअल फंड्स एनालाइज करती है और फिर टॉप फंड्स रिकमेंड करती है। म्यूचुअल फंड्स भी अब फोन पे।
Mutual fund investments are subject to market risks. Read all scheme-related documents carefully.
लगता है आ गए।
सर?
अबू, हमारे घर पेंटर्स क्यों आए हैं?
आप आइए। ईद आ रही है ना, पेंटिंग तो करवानी पड़ेगी। और इस साल तुम्हारे सारे चाचा चाची पूरा खानदान आ रहा है हमारे यहाँ।
पूरा खानदान? पर इतने लोग रहेंगे कहाँ?
फिक्र मत करो, जगह बन जाएगी।
आया। जो अपना है कैसे बांटे?
अबू!
और वो भी है।
दुनिया को कैसे समझाएं?
मेरा होमवर्क शेयर करना पड़ेगा।
हाँ बेटा, तुम्हारे कजिन्स के साथ बाहर ले जाओ, सबके साथ खेलना है ना।
मैं अपना बैग किसी के साथ शेयर नहीं करूंगा।
कैसे समझाए, दिल कैसे तू मनाए?
कितना खूबसूरत लग रहा है ना घर। अब आएगा ईद का मजा।
और खूबसूरत लगेगा जब सलमान के सारे कजिन्स यहाँ इकट्ठा हो जाएंगे।
लगता है आ गए।
दिल कैसे तू मनाए?
वालेकुम अस्सलाम, कैसे आप? एकदम फर्स्ट क्लास।
Provide stable fixation and earlier mobilization and reduces the risk of non-union and malunion. Hence, is less invasive, resulting in smaller incision. Conducted a study between March 2020 to March 2025 on 25 cases of the displaced fracture of the clavicle. The age of the patient was 16 to 48 years, and no comorbidity was found in our study group. All patients treated with titanium elastic nailing. So the road traffic accident was the main mode of the trauma, whereas the fall from height and the fall on the outstretched hand was the other mode of the trauma. So the typical mode of the trauma, this picture is taken from the AI, and this is a fall on the shoulder to protect the head injury in mode of trauma. And this is the typical presentation, a bump at the fracture site, and the skin appears as if the skin will penetrate the fragment will penetrate the skin. So, and this is the typical radiological picture, You can see the severely displaced fracture, more than 2.5 centimeter, a jet type of fracture, that type of communicative fracture, and the other indication for surgical treatment is the floating shoulder. So these are the typical presentation as well as the radiological presentation and the mode of the injury. And we included the simple fracture only, 15B1 and 15B2 according to AO classification. 15B1 is a spiral and oblique, whereas 15B2 is a transverse and short fracture. So the patient lies supine with affected limb elevated and hanging outside the table so that the reduction can be done by doing abduction and external rotation of the shoulder. So incision is 1.5 centimeter lateral to the sternoclavicular joint, and after making incision, we make a hole with the help of the drill bit or the bone out. But this is a crucial step. One should be very, very cautious because the heart and the lungs are like vital structures are waiting for your instruments to escape. So this is the very crucial step. And then make this hole continuous with the intramedullary canal of the clavicle, and then we did close reduction or mini incision reduction, and then titanium elastic bearing was done after reduction of the fracture. So the post-op protocol or immediate post-op, we did pain management and immobilization of the limb at the 2 weeks, the wound inspection and the suture removal at the 6 weeks, the radiological follow-up for the fracture healing, and by 12 weeks, the functional assessment of the fracture healing, and finally, if required, the implant was removed at the 12 weeks. The 6-month final follow-up was the 20 to 50 ml in all our cases. So the post-operative observation, excellent results, 76% of patients, whereas the good results were found in 16% of cases, whereas the 4% was the figure for the fair as well as the poor results. So the complications, the nail bite out, superficial infection, and malunion, each had 4% figure, and the hardware irritation was 8% in all our cases. We have few cases, the radiological as well as clinical picture. As you can see, this is 15B1 fracture, treated by titanium elastic nail, the post-operative case, and the beautiful surgery has been done. You can see the one stitch surgery, no instrument was used to reduce the fracture, only the thumb and the index finger was used to reduce the fracture, and abduction and external rotation of the shoulder was used to reduce the fracture. But this does not happen always. Many times we require the mini open reduction of the fracture. So this is another case we did. The 15B1 fracture has been treated by titanium elastic nailing. You can see the 6-month follow-up, the beautiful union, the secondary union. There are 2 bumps in the clinical picture. You can see at the fracture site, there is secondary callus formation. One bump is due to secondary callus formation, and other at the entry site, you can see that there is hardware from this. So this is another case of the mid-third fracture treated by titanium elastic nailing. Yet another case, 15B1 fracture treated by titanium elastic nailing. Yet another case of 15B2 fracture treated by titanium elastic nailing. And this is again 15B2 fracture treated by titanium elastic nailing. And this is 15B3 fracture. Ideally, it should be treated open reduction and internal fixation with the plate and screw. But we did titanium elastic nailing in this case also, and you can see that the beautiful union of the fractures at the 6-month follow-up period. So this is the functional result. limitation of this surgery, a number of cases included in this study was small and the short period of follow-up, and this is the retrospective duration, and a prospective study is required to establish this treatment as the attractive modality of the treatment for the mid-third fracture of the clavicle. So the take-home message is TENS snelling is effective for the clavicle fracture with good to excellent results. The minimum complication with properly selected patient and properly technique performed. So the further studies are needed to confirm the long-term efficacy of this modality of treatment. So thank you very much for your patience here.
If you're using AI in your workflow, then you might be facing these three major challenges. First, crafting prompts that actually get you the results you want. Second, knowing which AI tools to use for specific tasks in your workflow. Third, integrating AI seamlessly to save time rather than waste it. If you're stuck at any of these three hurdles, then I'd like to invite you to my Gen AI workshop that's already helped over 2 million professionals transform their productivity. In this workshop, I'll give you some insane strategies to overcome these hurdles. You'll learn AI frameworks and strategies and discover 25 plus AI tools, including ChatGPT, Gemini, Copilot, Midjourney, that will help you automate 50% of your workflow, save 2-3 hours every day, 10x your productivity, and show you what else is possible with AI tools that you can't even imagine right now. If you're interested, then click below and join my workshop right now. See you on the other side.
ये फ्रैक्चर है टिबिया का, कई भागों में विभक्त है और इसे डॉक्टर ठाकुर इनोवेटिव टेक्निक ऑफ सुप्रापेटनल नेलिंग ऑफ टिबिया के द्वारा ऑपरेशन किया जा रहा है। इस वीडियो में देख सकते हैं कि गाइड वायर को डाला जा रहा है और गाइड वायर फ्रैक्चर रिडक्शन के बाद परक्यूटेनियस फोर्सेप्स के द्वारा बिना चीरा लगाए रिडक्शन फोर्सेप्स के द्वारा उसे रिड्यूस किया जा रहा है। और रिडक्शन के बाद मैलिएबल गाइड वायर को सीआर के मदद से डाला जा रहा है और उसके बाद उसे मेडुलरी कैनाल को रीम किया जा रहा है और रीम करने के बाद नेल को गाइड वायर के सहारे सीआर के मदद से फ्रैक्चर को रिड्यूस पोजीशन में रखते हुए नेल को डाला जा रहा है। एक उचित साइज के नेल को सेलेक्ट करने के बाद उसे डाला जा रहा है। फ्रैक्चर रिडक्शन परक्यूटेनियस रिडक्शन फोर्सेप्स के द्वारा किया गया है। और अब नेल को डाला जा रहा है। हम नेल को फाइनली लोअर एंड ऑफ द मेडुलरी कैनाल डालने के बाद उसे अपर फ्रैगमेंट और लोअर फ्रैगमेंट को लॉक किया जाएगा। आप देख सकते हैं कि किस तरह से फ्रैक्चर का रिडक्शन हुआ है। ये है आरसीटी नेल इंट्रोड्यूसर कंपोजिशनर, जिसके द्वारा नेल को डाला गया है और अपर और लोअर फ्रैगमेंट दोनों को फ्री हैंड टेक्निक से सी आर्म की मदद से गोल करने के बाद होल को गोल करने के बाद इस तरह से सी आर्म को एडजस्ट किया जाता है कि होल गोल दिखे और उसके बाद उसे ड्रिल करने के बाद उचित साइज का स्क्रू डाला जाता है। देखिए बिल्कुल गोल दिख रहा है अपर फ्रैगमेंट का दोनों होल और उसके बाद स्क्रू डाला गया है। गोल दिख रहा है, स्क्रू डाला जा रहा है, अपर फ्रैगमेंट के लोअर होल में डाला जा रहा है। फाइनली दोनों स्क्रू को उचित साइज के स्क्रू को अपर फ्रैगमेंट में लॉक कर दिया गया है नेल को, और अब लोअर फ्रैगमेंट के एंट्रोपोस्टेरियर जो होल है उसको गोल किया गया है। इस तरह से सी आर्म को एडजस्ट किया जाता है कि वो गोल दिखे और एंट्रोपोस्टेरियर स्क्रू को डाल दिया गया है जैसा कि आप पिक्चर में देख सकते हैं। और देखिए अब मेडियोलैटरल होल है वो गोल कर दिया गया है। इस तरह से सी आर्म को एडजस्ट किया गया है और अब मेडियोलैटरल स्क्रू को भी डाला जा रहा है। ये मेडियोलैटरल स्क्रू डाल दिया गया है और एक लंबा सा स्क्रू जो आप देख रहे हैं वो एंट्रोमेडियल स्क्रू है। ये तीनों स्क्रू लोअर फ्रैगमेंट में दिख रहे हैं। इस तरह से लॉक किया गया है बिना चीरा लगाए, छोटा छोटा चीरा जस्ट स्क्रू घुसाने के लिए रॉड में। और ये फ्रैगमेंट फ्रैक्चर